today.com to discuss some of the growing issues, especially when it comes to family, surrounding the COVID-19 pandemic. I'm your host, Tim Walters. I'm the USA Today Network in Florida's video strategist, as well as the Florida Today Health Section editor, which I've done for about 5 years. And before I introduce my guests, I did want to share some news that came to us just about 2 hours ago now, that the Brevard County Commission Chair Brian Lober this morning announced Brevard County has experienced its first 2 COVID-19 related deaths. They are a 79-year-old male and a 76-year-old female, and we're working to find out more deaths or more details about the deaths. So please check back later on with FloridaToday.com throughout the day for updates on this. For our panel today, I'm joined by Abby Jones, and Abby is the Assistant Director of the Lifetime Counseling Center in Melbourne, and she's also a licensed marriage and family therapist, and she's joining us right now from Cocoa. And we also have Jeannie Raciti, who is the director of the Children's Advocacy Center in Brevard, which is located in Rockledge, and she's joining us from Rockledge. So we've been in quarantine now for about 3 weeks in Brevard County, and we're on our second week of distance learning for schools. And being at home during these times can be extremely stressful. In some homes, parents are trying to balance their jobs, teach their children, and in other circumstances, parents are dealing with job loss, yet their children are still there, and they needed to be tended to. So we're hearing about a rise in things like alcohol and substance abuse, child abuse, spousal abuse, and there's also anecdotal evidence that shows that both adults and kids are now less active than they'd been. We have sports and other things shut down, and we're eating more. So before we get started and I start asking questions, Abby, can you just give us a brief introduction of who you are and what you do at Lifetime Counseling Center?
My full name is Abigail Brown-Jones, and I'm the Assistant Director here at Lifetime Counseling Center. I've been with the agency for about 5 years, and I am a Brevard County resident and have lived in Brevard for the past 5 years as well, and relocated from Las Vegas. I've been a therapist for about 15 years now.
All righty, thank you. And now, Jeannie, why don't you tell us a little bit about yourself and your work at the Child Advocacy Center of Brevard?
Yes, thank you, Rob. I have been with the Children's Advocacy Center since 1999. I started with the Child Protection Team, one of our programs here at the Children's Advocacy Center. And I'm a licensed clinical social worker. I've been the director of the Children's Advocacy Center since 2015.
Alrighty. So my first question will go to Abby. Abby, as I alluded to just a couple of minutes ago, people are seeing alcohol being purchased in what might be considered record amounts for the amount of people that are out and about right now. And it's probably not a leap to say that that probably means there's a lot more alcohol abuse. What are your biggest concerns on that front? And what advice do you give people to try and refrain or find, something else to do other than, sitting at home and drinking when they're, have this fear and nervousness?
Well, again, so a lot of the concern comes from people who not necessarily are suffering from an addiction, but are now at home. They have less interaction with other people. They have some anxiety about all of this going on because the unknown is definitely anxiety provoking. And they're using alcohol as self-medication. And by doing this, they are obviously, from what the medical professions say, is that we are damaging several different parts of our body, as well as decreasing the effectiveness of our immune system. So again, some of my concerns is that people will form patterns of behavior even when on quarantine. And since this quarantine is going to be longer than 21 days, we've all heard the 21 days to a new habit, but also you can form unproductive and negative patterns of behavior as well. So my concern is that people will continue to use in amounts that they're typically not used to. Again, if you're anxious and you're looking for an immediate relief, try some of the positive coping skills that we know, or the pro-social activities in terms of meditation or reading something of interest to you on the internet, getting out outside, playing with your children, something that's going to help you to decrease anxiety immediately, as well as not damage your body and create negative patterns for you once this is all over.
Well, one of the really important things I heard you saying there was it can decrease your immune system, which is such a big thing right now, because we know that while COVID can infect anyone of any age, those with immune deficiencies or weakened immune systems are even more susceptible. So I think that that's really good advice and very sage words. Jeannie, recently I was watching the county commission meeting, and this would have been mid last week, and United Way President Rob Raines made a statement in front of the county commission that on the surface sounded like good news. He said that the number of reported child abuse cases have gone down drastically since school has been out. But then he followed up with something that obviously made it not good news. And that's because he said that without teachers and administrators seeing the signs of abuse, a lot are going unreported. What have you been seeing over the last 3 weeks or so? How do reports come in without those typical sources like teachers and health workers? And, how have you been checking on some of these at-risk young people?
Well, here at the center, one of our mandatory criteria for child abuse in Florida is our Florida Statute, Chapter 39, which highlights or points out those cases that are mandatory referrals to our center, the Child Protection Team, which is one of the programs, as I mentioned earlier, of the Children's Advocacy Center. And with that, every day I'm required to read every abuse report that comes through the abuse hotline here in Brevard County. We service only Brevard County. Some of my other agencies throughout Florida have multiple counties, but here we just serve Brevard County. So typically I probably read about anywhere from 30 to 40 child abuse reports every morning. And since the pandemic started about 3 weeks now, the reports have gone down for anywhere from 10 to 20 a day. So with the kids not being in school, there's less eyes on them, which means the abuse, if it's occurring in the home, it's not getting reported because the children aren't being seen in school, in the stores, in daycares, or even out in the community, like parks and recreation activities, baseball, any of the extracurricular activities. So the concern, yes, we would only want to hope that the abuse has gone down, but because of this pandemic, parents being out of jobs, working at home, and having to not only fulfill their job duties at home, but also now they're homeschooling their children and ensuring that they're getting their schooling completed. That causes a lot of stress. And then you mentioned the alcohol that people are using to cope with the stress, but unfortunately that increases behaviors in adults, and they tend to take it out on somebody, their stress, and typically that's going to be taken out on a child. There's also what I'm seeing in the abuse reports right now is a lot of domestic violence, a lot of substance use. We are having we are seeing some physical abuse and some sexual abuse being reported. Our main reporters right now is law enforcement, because law enforcement is out in the community.
Okay. All right, so Abby, I would imagine that children are picking up a lot of the tension and anxiety that the adults are feeling because of the virus, and that involves, health and our finances. What can parents and caregivers do to ensure this event won't cause lasting mental scars for our children? And do you encourage parents shielding them from the news that's just constantly on television?
Well, again, shielding isn't a word that I would use. I would say, again, they're going to be exposed to it on some level. They know what's going on. Children tend to be a lot smarter and pick up more than we think they do. So if they're exposed to it, which they are going to be, they're out of school because of COVID-19 or coronavirus, we need to explain it to them when they have the questions. Of course, depending on your child's age and developmentally and maturity-wise where they're at, you need to explain things to them so that they can understand. Children ask questions to gain information so that they can have an understanding and feel better about a situation. If your child continues to ask questions over and over and over again as they do, know that they're trying to be reassured. It's very important at this point to go ahead and make sure that we're reassuring our children with the information that we're giving them, and we're hearing them. We're justifying their fear and concerns. With most children, it's a simple answer will suffice. If they have more, they keep asking more questions. So again, it's exposure with explanation versus isolation. That's a key point I heard back in graduate school and still holds true today, and depends on how old your children are is what you're going to explain to them. You don't want a child sitting in front of the TV watching Fox News or CNN, but you do want to go ahead and explain and make sure they understand the importance of social distancing, of why we're washing our hands, why is it important, why can't they see their friends, and kind of do everything that you can to make the new normal for them. Including schedules for outside time, for video game time, for videos, for schoolwork, trying to have it as set as possible, because children typically do really well when schedules are in place and they know what to expect next.
Also, how would you address the kids who, are going to lose out on their graduation, or the athletes that didn't get to finish their senior season or something? How would you address those kids, Abby? Oh,
That can't be prevented, and we have to move forward. So moving forward may look different for many different children, many different seniors, many different sports teams. And I know that Brevard County schools, along with other school districts within Florida, are working on alternative measures. I've heard it in other states that they're doing almost a drive-through graduation where everybody is literally parked in their cars, almost like drive-in movies, and they're watching their children come across the screens. Others are doing videos. So it's important for the seniors and the sports people to go ahead and make sure that they are getting the closure that they needed on one of the most important chapters of their life so far, and to be able to validate that this really isn't fun and we're sorry, but we're going to do the best that we can.
All right, thank you. All right, Jeannie, the Child Advocacy Center is a collaboration between a lot of agencies. How has communication been with all the different people that you have to be with? And I know that, there's a lot of better, technical things that you can do, but a lot of times this is meeting with people in person and discussing cases and meeting with children and meeting with families. How difficult has this been without being able to bring people to where you are?
We have really great support with our partner agencies. And that's one thing I really value with working so closely with Department of Children and Families, law enforcement, Brevard County Sheriff, the State Attorney's Office. They value the Children's Advocacy Center and the services that are provided here. We've kind of taken it to a new level with our conference calling, rather in our meetings and our staffings, rather than, in person. We do a lot of phone conversations. We've done some Zoom meetings. I've actually held an all-staff meeting with my staff last week on Zoom. So I have my staff rotating in and out of the office. We try to keep no more than 10 people here in the office, and that includes our Department of the Children and Families, as we have one unit here in the Children's Advocacy Center. I think, when we do need to see the child in person, the exams, we're wearing the mask, we're taking those precautions. The child abuse hotline, the Florida abuse hotline, they're asking those questions. If the child has a fever, are there any symptoms? Have they traveled outside the United States or in those affected areas? So they are asking those questions during the abuse hotline call. And then when the Department of Children and Family investigator goes out to the home or contacts that family prior to bringing them to the Children's Advocacy Center, they're asking those questions again. When they come to the Children's Advocacy Center, we're asking those questions again. So it might seem kind of redundant to keep asking these questions, but, we could be talking 2 or 3 days, from the time the abuse report was was submitted to the hotline to the time they actually come into the center. Example, we got a call yesterday of a child needing a forensic interview. However, her neighbor is in ICU with the coronavirus. So she and her mother are quarantined right now. So we had to set that interview for the period she gets out of quarantine. So we're making those adjustments. On those acute cases, we're, again, having to wear the mask and taking those precautions. But so far, we've been very blessed and not having to deal with anything acute to where someone's come in affected or in the quarantine, with the exception of the case yesterday.
And you mentioned supplies like masks and things. Is the Advocacy Center still doing pretty well there, or have you had you see people in the community sewing masks and doing other things to help? Have you guys been all right in that department?
So this weekend I made 60 masks.
Wow.
So, and I'm actually selling those, and the money is going to the Children's Advocacy Center. But a lot of the staff wear the mask when they're in the office, but my medical staff have the N95 masks, the ones they're supposed to be wearing when dealing with the children. Some of my staff that do the forensic interviewing, we're keeping our 6-foot distance, and we're wearing our mask. We've had a couple cases where the children actually came in wearing the mask. So we're trying to take every precautionary measure that we can. The sad thing is we have to. We are an essential program, so we do have to see those kids that are coming in. Sometimes they're on emergent cases, and sometimes, we could schedule them out like we did on yesterday's case.
All right, thank you. Now, this next question for Abby. Abby, a lot of grandparents who are close to their grandchildren here in Florida, they're no longer able to see them. And, that's keeping the elderly safe. Children can be exposed to it and be carriers. How are you advising families to deal with children and grandparents involved? And, especially because a lot of older people are still technology averse. So what are some things that you suggest to help keep the grandkids and the grandparents together, especially if they might not know how to use Zoom or, FaceTime or something like that?
Well, again, so depending on the grandparents' ability to deal with technology, most grandparents are doing very well during this. They've kind of taken the initiative to go ahead and learn the technology. We're recommending Zoom. Even Facebook actually has an app just for kids, and it's Kids Messenger, to where as a parent, you can see what the kids are posting and you approve who they can chat with. So, a lot of families are using the Facebook Messenger, they're using Zoom, all sorts of technology. And then again, even if the video capacity is not there or nobody's kind of comfortable with that, you can go ahead and pick up the telephone and have that conversation. It's very important to keep relationships going during this time. Again, we are doing social distancing, but we're not isolating. We don't want our children or the grandparents to feel that way. So it's very important to have that connection, even though it's not a live touch feel connection, we can still have that relationship building time. And sometimes when you take other things out of the mix, including, going to McDonald's and getting ice cream or the park, we've seen that the older children can go ahead and form better relationships with their grandparents overall.
Yeah, and that's tough, especially with Easter coming up this weekend, a big time for families to get together. So I know a lot of people are really stressed about what to do there. So that's unfortunate. Okay. So Jeannie, you've dealt with, obviously, dealing with children is a big part of what you do. How would you suggest that we speak to the youngest children? And I'll give you, for instance, I have a 5-year-old and she doesn't understand why she can't go back to kindergarten. She doesn't understand why she can't play soccer. And when I try to explain to her that there's a bad illness and that we can't go out, she just says, I feel fine, and so how would you, what's the best way to communicate with our 4 and 5 and 6-year-olds who don't understand why they can't go back to school?
There's some books out there that are great to work with kids. And, of course, they haven't written one for the coronavirus, but definitely, you want to listen to your child, you want to address their fears, but, they're going to have questions. And I think simply putting, well, right now, this is what we have to do. And, we're going to find some ways where, we can make the best of it. And I think, just with the families working with their kids and, enjoying that time with them, it almost takes us to a new level because, we have been so focused on, all our social media and all our, toys, with, our phones and our computers and our gaming, we've kind of lost the family connectiveness. And I think this is a good time where, to bring the families back together. And it's almost like we're learning how to be a family again. And when we bring in for the younger kids a lot of that play, and that's what we do with our kids here, the younger kids, to address their trauma, is we do it through play therapy. So you might want to, get some, I don't know if you have a boy or a girl, but, play soldiers or, the dollhouse, and just kind of act out, what's going on in the world right now. And they might understand, they might not. Children are resilient, which, is a good thing. We've gone through the World Wars, we've gone through 9/11. Now we've come up, we're going through this pandemic, and children have questions. But I think it's important, and it's our job to, ask our children, how are you feeling? What questions do you have? And the younger ones, my grandkids, they're 5, or actually the one just turned 6 and 3. And, Wyatt, we played a joke on April 1st, and we said, hey, actually his mother did. The school called you going back to school. He just started crying because he's just enjoying his time home. But he's a very smart kid, and, even though he enjoys school, he's also enjoying his time at home. But I know, just sitting down with them and explaining, this is what's going on has helped. And with the younger one, it's simply, doing some play with him.
Yeah, and it is nice, we, my wife and I, we alternate between our jobs and teaching our daughter, and it is nice to have, lunch as a family every day. We try and eat dinner as much as possible, but, there are some of those moments. So I definitely agree in that it is, it's giving us some of that time that we just haven't been able to have. And so that actually leads me into my next couple of questions. And this is for either of you to field. So if one of you wants to raise your hand, by all means. So as we just said, couples are spending more time together. I heard one person comically put it that it's like having 5 years of marriage crammed into 1 year. So what do you think is more likely, or if you were to look into the next 9 months, do you think that we're going to see a spike in births? Do you think that there might be more divorce? Do you think there might be both? How do you see the next several months playing out?
All of the above. But I tell you, I see more people in my neighborhood doing a lot of exercising, walking. People, I've been there 6 years and I haven't seen some of these people. So, and I know I've gotten my husband out on the bikes and walking. So, I don't think we'll head for a divorce, but definitely with the small kids, it does raise the stress level. But that's what, these parents need to do, is to get out of the house, get out with the children. Yeah, we're not supposed to be, going to the beach and in parks and being together, but we can still exercise, walk, and just keep our social distance. But I think that helps with our mental health, and it hopefully won't gain weight during this quarantine or become an alcoholic, right?
Well, and that was going to be one of the questions I asked. Do you see, a year from now, when they do their yearly statistics on things, do you think when they look back at 2020 several years from now that we'll have seen a big increase just on that 1 year for childhood obesity because they can't play their normal sports and, we're told to stay inside more? Or do you think that because maybe families are going out more, are they just staying fit in different ways? Like what are you guys seeing out in the community?
I think on this end, we're seeing more of the children actually getting outside. Yes, they go to school and they have PE and what have you. But being a working mom myself, it's very difficult to go ahead and, do extracurricular activities once I'm home from work. Working from home at this point, allows me the ability to encourage my kids to go outside. And to do different physical activities that we haven't done. So being at home and the stay-at-home order being in place encourages a lot of families to do other things together. And when we get bored of video games and TVs and things electronic, it's time to get outside and go be physically fit. So I really don't think the numbers are going to reflect that. If anything, people actually might see a decrease in the flu in the next couple of years because the younger children now know how to properly wash their hands.
I think that's the thing we've probably all heard more than anything else is wash your hands, right? Alrighty. And then the final question that I'll ask, and again, this could either of you or if both of you would like to tackle this one, when we finally do start to open our society back up, and when people are allowed to start going to beaches and restaurants and things, and knowing that there's still not a vaccine or a therapy developed yet, do you think society will ever become comfortable being near each other again? The mental toll that it's taking on people. Are we going to always feel a little odd sitting now within 6 feet of somebody? Because, you said 21 days to a habit. We get used to being away from people. And, in a few months, hopefully, we're going to be back near them again.
I don't think so. I think we're going to want to get out and reach out to people and have gatherings and want to do, I miss hugs. I'm one of those people that like to hug, and, now we do a lot of virtual hugs. So I think we're going to be more apt to want to go out and meet up with people, go to restaurants, enjoy the beach, enjoy the parks, get out with our families. And I think that, during this time, we're learning how to become that family and how to be together again. And I think that's going to impact us in a positive manner.
What do you think, Abby?
Again, I agree kind of with what Jeannie is saying. I'm not seeing people kind of just staying in their homes being fearful. I caution that people may be too eager to go ahead and get out of their homes and have those gatherings before it's safe to do so. But once we get the go ahead, I think you're going to have some people who have reservations, but most people will jump right back into society. I know the little people or the children are definitely missing the social interactions and the interactions with their teachers, grandparents, and others that they usually have. So, and they're very non-understanding of social distancing. So again, allowing them to kind of be children and go back to the parks and go to the beach and do things that they're not permitted to do now, I think is going to be something that most people are willing to do without reservation.
All right. Before we wrap up, would either of you like to add anything else? We'll start with Jeannie. Is there anything else you'd like to say to Brevard County?
Yes, I just want to, just send out, a lot of positive vibes out to the parents at home. This is a whole new level that they're taking on, working from home, being laid off, their kids are at home. There's a lot of tension, a lot of stress. We don't know what tomorrow is going to bring. There's a lot of resources out there that can help families. The internet's a wonderful tool. They can get in and Google just about anything. Keep your children, active. Keep you active. Be kind to yourself. Don't beat yourself up as a parent. Oh, I'm doing a terrible job. We're all taking this a day at a time. We're all figuring this out. Whether we have kids, little kids or big kids, we all have, we're all in this together, as they say, right? But we need to support one another as well. And just, have your day-to-day activities with your kids, be consistent, talk to your kids, address their fears. Parents need time out, kids need time out, and that's a healthy way to be. But just remember, that Brevard County is a wonderful community, and it's a community full of resources, and those resources are out there. And if anybody, the Spaceless Health Foundation is a good website to go to for resources, United Way, the Children's Advocacy Center, Lifetime Counseling Center. So we all have A lot of good stuff on our website. We have the Florida Network of Children's Advocacy Center, the National Children's Advocacy Center, National Children's Alliance, the Ounce of Prevention. This is Child Abuse Prevention Month this month. So wear your blue, get out your pinwheels, put a fun thing for kids to do if you have any pinwheels, or even make them, plant them in your garden. But we're in this together, and we want to support one another. So there is help out there, and just keep a smile on your face. That's all we can do, right?
Very true. Thank you, Jeannie. And how about you, Abby?
Again, I think just everybody paying attention and being mindful where they're at. Self-care needs to be done by caregivers, by professionals. It's something that right now we all need to take that extra minute and make the time. Nobody has spare time or free time to go ahead and do those self-care rituals that we know we need to, but it's really important during a stressful time like this to go ahead and do that self-care, and then make sure that we're checking on each other. They're saying that it could be, depending on how people interact and react to the crisis, a very traumatic time for a lot of people. So if you know one of your neighbors doesn't have a lot of contact with their family, or maybe the younger teenagers, check in with your friends, make sure everybody's doing okay. And if they're not, get the help that they need. 211 is a great resource for mental health and otherwise to be able to get the information and possibly additional assistance you need. And again, like Jeannie said, our agencies all in conjunction are working to make sure that we can help Brevard in whatever that looks like, be it mental health, be it financial, be it support. We're here for everyone, and we're just trying to get the word out that we're still up and running and kind of doing what we need to do in a different platform. But for now, this is our normal, and we will proceed as always.
All right, that is great. Thank you, Abby. I'd like to thank Abby Jones, the Assistant Director of the Lifetime Counseling Center in Melbourne, and Jeannie Raciti, the Director of the Children's Advocacy Center of Brevard, for taking the time out to talk to us about these important issues today. We'd also like to thank Wayne Price with the Space Coast Health Foundation for helping us set up this meeting. And last and certainly not least, we'd like to thank our technical wizard, Mr. Rob Landers, for making this live stream happen today here at FloridaToday.com. Please remember that in these challenging times, local journalists are mandatory and important for our community. And we humbly ask that if you are not a subscriber to Florida Today, that you please consider. And if you are, you have our profound and humble thanks. My name is Tim Walters, and I'm urging you to stay safe. And for now, stay inside, and together we will all overcome this. Have a great day, and thank you, everyone.